Sorry.
Go ahead.
So I was saying my computer was kind of talking to itself. Sorry about that. I was saying,
That's all right.
what about if you equate direct like 80 MEQ in 250 ml, right?
Yes.
What about 3 hours? Is like 3 hours is equals to what? So it's 80 times 3 divided by 250.
No. If I were to just put a picture of a bag here, this has 80 over 80 milliequivalents is insignificant in this problem. Oops.
How I can make that clear in my mind? How I can not think I have to plug that number? Just because I'm figured out the rate, no?
Yeah, just because, yeah, I'm trying to figure out how to tell you. Let me find a picture. Maybe this will help you. See this bag? You see this bag?
Yeah.
Yes.
I want you to get this bag, and there's 1 liter or 1,000 mLs. I want you to get this in 10 hours, which
10
is
hours.
slow. So how much per hour do you need to run your pump to get this bag in 10 hours?
100 ml.
Yeah. Same
per hour.
thing. It doesn't matter what's in the bag. Okay.
Because what you're asking is how
I'm asking you. Yeah, I'm just asking you to infuse this solution over 3 hours.
Okay.
So it has nothing to do with this, what's
What
in the bag.
kind? Okay,
Yeah,
what is in the bag?
yeah.
Okay.
It's a time factor. You don't have to calculate any dose or anything.
I think it's clear for me. I don't know if for him it's clear.
Does that make sense,
So
Jeffrey?
okay, I'm confused a little bit. So what's the math asking about? Infuse a solution of 8 MEQ in 250 ml to infuse over 3 hours.
Yeah, that's what the order is. Please get this bag of whatever the drug is in over 3 hours.
Can you use the formula ordered over variable and get that answer?
You don't need that, okay?
Oh, you don't need that. Okay, I got you.
No, because we need 250 mLs. Whoops. Try it here. We need 250 mLs to be infused
in 3 hours.
In 3 hours. That's what they're asking you. Would you please get this in 3 hours?
So it's like you divide by the direct 250 divided by 3 hours, right?
Yeah. So they're asking you, what's the hourly rate?
It's like 83 per hour.
83.9, right?
0.333.
83.333.
250 divided by 3.
All right.
83.
Yes.
83.
And so the next one is the same thing. Okay, just
okay, I understand. So it's kind of they throw you off. You don't even need to use the 80 MEQ. So it's just like you overread. You don't really understand the question. That's the problem.
Right.
In some problems, not in all.
Huh?
Yeah.
I want to tell him. I think he has the same confusion than me.
Yeah.
You have to see what they want from you. If they want just the rate, we just have to focus in how much we have, how many ml, and then we're gonna divide for the time
like that
they
one.
want it.
900 MEC. 900 divided
So
by,
would it help you if it was written like this? Infuse 900 micrograms in 100 ml over 40 minutes. What's the hourly rate? Does that help you?
yeah.
Okay.
So that one you're
So
gonna
how would you
divide
do
by,
that one?
Hmm?
How would you do this one?
that one you divide 900 MECG, because it's in minutes, because 1 hour is equal 60 minutes. So you multiply the 40 minutes into 1 hour times 60 divided by 900 900.
No, we don't need to do anything with 900.
We don't?
No, this is the
Okay,
same
okay,
thing.
I got you. It's
Yeah,
100 ml.
So I put in here 100 ml in
Times
40 minutes.
divided
So
by
what is, yeah, so ml per 60 minutes would give you your rate then.
2.5 times 60.
Yes. 100 over 40 minutes is the same thing as
150.
what over 60. Yeah.
150.
So what's the answer? 150?
Yes.
I don't even know what it is.
Yeah, it's 100 divided by 40 times 60.
$150.
Yeah, 150.
Yep. 150. You're right. So make sure you read the prompt and don't make it any more difficult than what it is.
I think that's why. I mean, I'm good with math, but this simple math with I don't know why. Sometimes I overthink, you know.
Yeah, well, you're not alone. Okay, let's do this one. The order wants you to give 500 micrograms subcutaneously. Okay, you have a vial. Okay, you have your medicine vial. It
Mhm.
says that there's 1 milligram for every 5 mLs. So what you have is 1 milligram for every 5 ml. Whoops. Whoa. So, but you only need,
500.
yeah, 500. So we have to convert, don't we?
Yes. We do.
100, or I'm sorry, micrograms, 1,000 micrograms
Yes.
in 5 ml. Right?
Mhm.
Is that the same thing? Okay.
Yes.
So that's the same thing as what? Whoops.
Yes. So.
And
what
we only want 500 micrograms. So
Yes.
what's this volume?
We divided 500
So it's
for
500 times
1,000.
5 divided by 1,000.
Yeah. Uh-huh.
It's gonna be 0.5. And
It's going to be half of it, right? So what's half of 5?
$2.5.
2.5.
2.5. Yeah,
That one was easy.
that was easy.
It was easy.
Let's do this one. Oh, we already did that one. Okay, let's go down and do a little more difficult one. All right, let's do this one. I'll make it bigger for us.
Okay.
All right.
500 ml.
Now, we have a solution that has 500 mLs in it. And it's labeled, there's 100 milligrams of this drug in 50 for every 50 ml. Okay, that's what it's labeled as. Even though the solution contains 500 mLs,
It's labeled 250.
we know that there's 100 in every 50. Okay.
So that's if 100 ml, if 100 milligrams It's in 50 ml. Am I right? So 250 ml is equal ml is equal to what? So it's 250 times 100 over 50. So it's gonna be 500. Am I right?
Okay, so what you can do is then you're gonna equal this to, you don't know how many, let's see,
In 250, yes.
Yeah.
So the answer is 500.
right? So how much of the drug will the client receive if they're getting it at 250 an hour?
500.
500, I haven't calculated myself. See, 100 over 50, 250. I don't have this set up right. X over 250. There we go. Is that right? So if X, let me go back up here.
25.
X equals 500 what? What we just calculate? 500 what?
500 ml.
No,
Hold on. 500.
Milligrams.
yeah. Okay, so if we're running this solution at 250 an hour,
I see. I should cancel ml and ml. Okay, I do see that.
yeah,
Mm,
we're giving the client 500. If we were to run this for 4 hours, I think is what it says.
100 milligrams equals to 50 ml.
Oh, after 1 hour, how many would the client receive? Okay,
250.
do you understand
I
that?
don't
Mel?
understand. No, I don't understand the 500. How you do the 500? How you calculate? If I divide
Okay.
or time,
I
it's not
have
giving me
100
500.
over 50. I have 100 milligrams over 50. And then X over 250.
500 milligrams. I got it. But I wasn't canceling the milligrams and milligrams. I mean ml and ml, so it cancels so that you can make it with.
Right, right. Okay.
Where the 500 come?
That's dimensional analysis, professor, right?
What?
The one you're using is dimensional analysis, right?
No, I'm not doing dimensional. I'm doing this to show Maybell. Okay. Okay,
You time 250 times 50.
no, you're going to cross multiply in this one.
Oh, this is cross.
So 200 times 250 is 25,000, isn't it?
2000.
Or 2,500. 2,500.
250. You said 250. I think
I did. Okay, you time the 100 for 250, and then you divide the 50.
Yes.
How I know I have to do that? And what problems?
Because of what the question is asking you.
Come on the same.
For me, I kind of quit like this, like
Uh-huh.
100 milligrams of. So it's like 100 milligrams over 50 ml is in 50 ml. What
Yeah,
about
this is what we have, yeah. But we're
250
gonna give
ml?
her 250, yeah.
So it's like 250 times 100 over 50 ml, right?
Yes.
Mhm.
Okay. It's 500 milligrams. So that's the answer?
Yep.
I would have gotten it right. But they are kind of tricky sometimes. I don't know. It's not like they're hard, but they can trick you a little bit if you don't think twice.
Yeah, you have to really read what is it asking you. I know when I was first learning how to do this kind of stuff, I would draw pictures because I'm so visual. I would actually draw a picture of an IV bag and label it 100 milligrams and 50. So I know how much I had in 1 ml.
Yeah, that's cool.
Okay, I understand this. My only concern is how I can get really good, that I can see that problem. I know I have to do it like this.
I would say probably doing it over and over again.
Okay,
So if we have
But,
100,
with other numbers, practicing with other numbers, plugging other numbers.
yeah, plugging in different numbers, we can
Okay.
have, we can do 1,000. Or let's do smaller numbers. Let's do 100 ml solution. You have 100 ml solution bag, and it's labeled
25.
yeah, we'll put 25, 100 milligrams, and we're going to run it at 25 an hour. You want to run it at 100 an hour? Okay, let's run it at 100 an hour. Okay. 100 milligrams and 25 ml.
100 milligrams over 25 ml
400.
equal X milligram over 100.
What'd you get? What'd you get?
400.
Oops. I'm trying to do this. I don't like doing this with my computer. I detest it.
Yeah, it's 400.
Okay. You see that, Maybell?
Yeah, it's 400. I see clearly.
Okay, okay. So that's the same idea. Okay.
Okay. I'm gonna take 5 minutes.
Okay. Jeffrey, what concepts do you want to work on?
I
Did you
think
have
there's, I think one, there was a math which was on the quiz. I don't know if I got it wrong. Because I got a quiz at 90. I'm sure I got one. I don't know if I got the math wrong.
what
you-
class do you go to? Who's your instructor?
Professor Susan
Oh,
Kranovich.
yes. Let me see. She teaches P1. Let me see if I can see what you missed. You did well.
I wanted them all, but
You've met with her and it's really proven out, hasn't it?
yeah.
Okay. You didn't miss the math. She gave you a comment.
Oh, I didn't look because I can't access my Canvas. So probably I need to select. Oh, I didn't miss the math, and then I'm good. Probably I missed the select all.
No, actually, you got that one right. What is it when you have a baby delivered?
Mhm.
What is the very first thing that you need to do with that baby?
Okay, that question was very tricky to me because I know it was. I don't know if the question was framed right. Because I know you're supposed to administer vitamin K.
No, we're talking about immediately after delivery. Immediately after delivery, what do you do?
No. I was telling you what I was. It's kind of challenging, like the way I was thinking that question. But I think I didn't pick the vitamin K. I did like because you gotta stimulate the baby check the reflex for 1 minute. Then if the reflex is below 7, check after 5 minutes. So I picked that. I don't know if I got that right. Oh,
No, you said that we needed to do the APGAR before we do anything else.
so I thought APGAR is the APGAR score, right?
Soon as that baby is born, we are worried about what 2 priorities? What are we concerned about? 2 things about our newborn.
Safety, I guess.
Safety, yes. What is it that we need to do for that baby?
You gotta check
Okay.
make sure the baby they're crying or
Okay, so we know that
Temperature,
yes. So we know that there are 2 priorities for a newborn, okay? And temperature,
Then,
right?
okay.
They cannot regulate their heat. They're relying on us to prevent heat loss. And what's the second one, Maybell?
Temperature.
respiration.
Respirations. Okay, so that is huge. Those 2 things are what we're doing initially after a baby's born. So when that baby is born and we're waiting that 1 minute to clamp that cord, you need to be drying that baby off.
Wrapping
What
like
happens? What happens with a wet baby? A wet baby.
Evaporation. We're gonna lose heat
Evaporation.
by evaporation.
They lose
our
heat by
babies at risk.
evaporation. So yeah, stimulate that baby to breathe and vigorously dry that baby with a nice warm towel. Yeah. So those are the 2 things that you need to do.
Oh, so the question I was thinking in my own what. So what was the answer for that question? Temperature.
The answer for the question was to dry and stimulate the baby.
Oh, okay, I know. I did that thing on, like you kind of singed on my head on Saturday when I did the sim rap, when the teacher was explaining and holding the baby, like you gotta do like this. So, and you can't go soft, like you gotta kind of like, you gotta be not too rough, but you gotta stimulate the baby,
Yeah, you do. You want the baby to breathe.
Yes.
And you want to dry the baby off. Yeah, so those are the 2. That's the one way they lose heat, evaporation.
And
Do you
that's
remember the other? How else do they lose heat? You remember the 4 ways they lose heat?
Radiation,
Radiation,
convection,
conduction,
conduction.
yeah. And radiation and evaporation. Those are and as OB nurses, as nursery nurses, we need to know that, right? Because if we're caring for this baby, we're gonna avoid heat loss in that baby. If we know that, we're gonna avoid putting a baby on a cold scale or a cold room, a drafty room. Okay,
That's right.
all right.
Mhm.
But you got the math right on the quiz.
I thought,
Oh my God.
I mean,
Yeah.
I was thinking when I saw I got that quiz, I was like, I missed one. I was like, probably I missed the math. Sometimes I'm not sure if I missed the math. So I was
Yeah,
thinking maybe I missed
yeah.
the math.
Well, you look at, you go to Canvas when we get done here and look at your quiz because your instructor commented. She submitted a comment, so go back and look at what she said.
Okay, cool.
Okay, okay.
Yeah.
All right, what else do we need to go over? Tell me some normal reflexes of a newborn.
Babinski, is it compared like normal? Like-
Okay, Babinski. What is the Babinski reflex?
Like the one kind of like you touch on the foot, kind of like that.
No, that's not Babinski.
It's the toes.
Yeah,
The
it's
fanning of the
the
toes.
foot. Yeah, yeah.
The
So
foot.
when you stroke the foot of a newborn, they'll
That's the-
actually fan out their toes.
That's Babinski.
That's Babinski.
Yeah.
Yeah. So if you have an adult and they've had brain trauma, head trauma, and you're checking their reflexes because you're assessing brain damage, neurological assessment. If you do that to an adult and you get that kind of a response, there's brain damage.
Hmm.
Okay. Because an adult, what you want them to do is you want a stroke and you want them to curl their toes down. But a newborn up to about a year old, they
Fanning, like pain.
they do this with their feet. They extend their toes. Okay. What other reflex? What was the other one you were talking about, Jeffrey?
No. That's what I was saying. The Babinski is like when you touch them on the sole of the foot, right?
Okay, yes.
With the
Yes.
moral reflex, right?
What's the moral reflex?
Moral reflex is like you put like a thing and then they start sucking.
That would be the sucking reflex.
Oh, sucking. Sorry.
When they open their arms and
Oh.
make a C with the hands, like a C.
Yeah. Yeah. They're afraid. Yeah. The startle, it's also known as a startle reflex.
Oh, startle reflex.
So what if you don't, what if the baby doesn't respond with a startle, with a moral reflex? What could that mean? No moral reflex. What could that mean?
The baby might be having some defect.
Uh-huh. Neurological defect, yeah, damage or injury or something. What else?
Maybe the
Is-
baby.
Can be dead.
Yeah,
Oh,
yeah, it can be deaf. Uh-huh. It can be deaf. They don't hear you go like that.
Oh,
Because
they-
that's how we stimulate. If we clap our hands, that's what they'll do.
oh,
Yeah, they might be deaf. Okay. All right. What do you call it if you put your finger on the corner of the mouth and they turn their head towards the finger? What is that called, Jeffrey?
Oh, I mean,
Do you have any children, Jeffrey?
I got 3.
Yeah. Uh-huh.
Yeah,
That's
but
okay.
they're big now. What the first one is 15, the second one is 13, the other one is 4. It's about to be 4.
Oh. Okay.
Yeah,
It's called suck or rooting.
that's the
It's
root.
called the rooting reflex. They're rooting. Yeah. They're rooting around for a nipple. You know, when
kind of
cats
thought-
or dogs, when cats or dogs are born, one of the first things they do, they're looking for something to drink. And they're rooting around on mom's belly, hunting for the teat. Okay. All right. So you remember what kind of infections that sometimes we see in the postpartum period?
Chorioamnionitis. Is it choreo?
Chorioamnionitis, usually during labor. That's referred to during labor, but what's the secondary infection after that? If we don't treat chorioamnionitis.
You said after labor?
We're talking about postpartum.
Postpartum.
What kinds of things do you want to observe for and teach your client about? Infection wise.
To monitor temperature, like temperature not to be
And
over.
yeah, we're going to watch for hemorrhaging.
Watch for him.
What infections though are you watching for? Go ahead, Maybell.
Okay, endometritis.
Okay,
Mastitis.
endometritis.
Endometritis and mastitis. Mastitis is another one in the breast.
Yeah,
It's
mastitis.
Mastitis.
Yeah, it should be mastitis, but mastitis.
Because it's inflammation.
Yeah, so in the breast,
think-
it's the inflammation or the infection in the breast tissue. Okay, not the nipple area, but the breast itself, the lactiferous ducts. A lot of times it's caused by a clogged milk duct. Okay, what would you see in your client? If you're suspecting it, what are you seeing?
The nipples are swollen, painful to touch.
No, the nipples are fine.
I mean the breast.
Okay,
They are swollen, painful to touch.
they're what?
Painful to touch.
Yeah, so tenderness, yes,
Tenderness,
tenderness,
sorry.
okay. But that's the same thing, painful if you touch it, What else do you think you would see?
They're engorged.
Engorged, yeah, they might normally be engorged,
Mhm.
okay? What else would you see if it's infected? Tender, painful,
Painful to touch. Tender.
what are the
Erosion.
symptoms? What?
Erosion, like an erosion, like red and the
Okay,
skin is gonna
okay,
look
okay, so we call that erythema, erythema, so it's kind of reddened, okay? So warmth and redness, what other symptoms is she gonna have?
but she could have fever.
Yeah, she could have a fever. She's gonna feel fluish. It's a serious infection. We need to give her some antibiotics. We usually treat her with it's called dicloxacillin. It's a penicillin.
Penicillin.
Okay, yeah, it's a penicillin. So what are you gonna teach mom?
Take the medication as prescribed
Okay,
and do not stop, because if you stop taking the antibiotics, it might be resistant or irresistant.
resistance, yeah, you're right. She needs to take them till they're gone. What else?
Drink plenty of water and make sure you eat food.
Okay,
What else?
how can we give her some comfort?
Encourage that she'll be the after at least reassure her after she's continue taking the antibiotics, the symptoms will subside and she start
Okay.
feeling better.
Okay. What would you teach her, Maybell?
I will tell her to keep feeding the baby. Do not wash with soap and keep feeding the baby. Take a warm bath and after that feed the baby.
So warm compresses, we call them. So we can take a moist towel that with warmth and place it on that area of the breast.
What about
That
the catheter?
helps. Yeah, that helps the vessels to dilate and reabsorb to fight the infection. And it gives some comfort. It helps the breast milk to let down, or colostrum, however, it's usually postpartum later on, after they get home, when they develop mastitis. So warm compresses keep the breast empty, continue breastfeeding.
Continue
Um,
breastfeeding or continue pumping, and if the
One or the other, yeah, or both, yes, yes. A supportive bra. She needs to have a bra that supports her breast. Okay, good.
what about the cabbage?
Cabbage leaves are for women who are not breastfeeding.
Oh, okay. For women who are-
And cabbage leaves there's two things. They're cool. Okay, so we want women that are not going to breastfeed to bind the breast or support the breast. No stimulation and cool compresses or cabbage leaves, ice.
So what
Okay.
what the cabbage does is just kind of like
Convenient
convenience.
because the way they're shaped, they're
Oh.
cups. Yeah, the way they're cupped, and that helps hold ice.
Okay.
Okay. Okay. You might hear some other reasons, but okay. Urinary tract infections sometimes are common too. So what are some things you would teach your client to help prevent urinary tract infections? Do you know?
I will teach the patient, like, do not hold, like, whenever she feel like she need to pee, she need to go ahead and do it.
Yes, yes. So
Well,
keeping her bladder empty. What else?
plenty of fluids, drink.
Plenty of fluids. Make sure she's eating right.
Yes.
And clean front to back.
Okay, so hygiene, pericare, changing her pad often, rinsing from front to back. Those things. Okay.
Mhm.
Those are all good things to help prevent urinary tract infections. All right. Let's see, what else? Somebody tell me the process of bilirubin conjugation. What do we mean by conjugated bilirubin, unconjugated?
I think I need to go. I mean, I need to go. The teacher said that on Friday. I need to review it again. I see it, but because I know
Okay.
like, you need to breastfeed the baby. The more you breastfeed the baby, it kind of release that.
Yeah, yeah. So there's colostrum, especially that colostrum, because the colostrum is a laxative.
Uh-huh.
And it helps that newborn pass stool. Okay. And that helps pull out some of that bilirubin. Yes. Feeding the baby often. Yeah. So whenever red blood cell breaks down, it releases bilirubin.
Okay.
And the red blood cells of a newborn don't survive as long as an adult. So there's a lot of breakdown of red blood cells initially. Okay, especially if the cord was delayed in camping, they have extra red blood cells. So bilirubin levels are going to be high. Their liver can't conjugate. The liver cannot, at that age, is not able to bind that bilirubin. So it circulates through the tissue. Okay, and we need to get rid of it. Okay, so feeding often is one way of doing it. And then the other way is phototherapy. Ultraviolet light helps it works it actually chemically changes bilirubin.
That's why
So that, yeah. So we use phototherapy.
phototherapy.
Okay. Yeah, phototherapy for bilirubin. could be going on if your baby develops jaundice within 24 hours after birth.
After 24 hours.
Within 24 hours after delivery, your baby's already jaundiced. Let's say 12
Pathologic
hours.
jaundice. It's a pathologic jaundice. That means is the baby came with addictions and
Okay, so it's pathologic if it's within 24 hours. What usually causes pathologic jaundice within 24 hours?
addiction from the mom. Probably the mom has hepatitis. No.
Hepatitis, no. So if you know that the liver it's important that the liver conjugates bilirubin. Some reason during the pregnancy, bilirubin levels were high in the baby.
Oh, during the pregnancy?
Or let me say, it's not that the bilirubin levels were high during pregnancy. What was occurring during pregnancy is that the red blood cells were being broken down during the pregnancy. Okay?
In the baby
Hemolysis
or in the mom?
in the baby.
On the baby, okay.
The baby during the pregnancy, the red blood cells were being hemolyzed. Okay?
Okay.
Okay, so when and that's fine. I mean, the mother's liver can take care of the bilirubin, but once that baby is born, there's a lot of bilirubin builds up very quickly. And within that first 24 hours, that baby's going to be jaundiced. Something was causing during the pregnancy the breakdown of red blood cells. Do you know what that is?
The breakdown of red blood cells.
Of the fetus. Uh-huh.
That thing.
It's ABO or RH incompatibility.
Oh,
The blood types don't match.
Okay.
Oh,
Yeah, so mom did not get a RhoGAM shot in a previous pregnancy.
That's
Okay,
fine.
so
Okay.
ABO incompatibility, you're going to see jaundice
ABO.
early onset, yes. Mhm.
ABO.
Pathological jaundice is associated with ABO or RH incompatibility. Yeah,
You say ABO or?
yeah, a blood type, type A, type B, type O, or an
Incompatibility.
antigen. Yeah, or an antigen on the
Okay.
blood.
Okay, I didn't.
Okay.
Yeah, so that's your pathological jaundice. Okay.
Pathological.
So I'm going to give you a quick assessment of a newborn, and you're going to tell me what health problem the mother had. Okay,
Mhm.
you ready?
Okay.
So the
Yes.
baby is alert. APGAR score is 7 and 7. Baby is breastfed at midnight. Baby was born at 11:30 and was breastfeeding at midnight. And at 4 o'clock in the morning, baby wakens up and is jittery, irritable, a little cold. What's going on with the baby? Baby has hypoglycemia. So what?
Oh, you already say it has hypoglycemia?
So the baby, yeah, so the newborn is experiencing some hypoglycemia. What was the mother's diagnosis?
Diabetes.
Diabetes. Yeah, mother had gestational or type 2, type 1 diabetes. So baby becomes hypoglycemic in a short amount of time. So 4 hours is a long time to go without feeding a newborn anyway, especially if she's breastfeeding. How often should we encourage moms to feed their babies?
Yeah.
Yeah, every 2 to 3 hours. And if they were a diabetic, we might say every 1 to 2 hours.
Okay.
Okay, every couple hours. All right. Let's see, what else? you have a client who's 18 years old, and she just delivered a newborn who is kga 4 kilograms in weight. Okay, a small baby, preterm. Okay, low birth weight plus preterm baby, stable respiratory status, positive pressure, CPAP, and the mother refuses to have the baby or refuses to interact with the baby, and you're checking on mom in the middle of the night. You work on the night shift because you're a new nurse and they made you work at night. So you're going in to check on mom, and she's sitting up in bed talking, just talking to someone, but no one's in the room. What could be going on?
Postpartum depression.
If she's talking and there's no one in the room,
I think it's psychosis.
psychosis,
Mm.
yes, or she's hallucinating, yeah,
Hallucinating.
psychosis. So sometimes young women, with their very first baby, it's something that was unplanned, the stress is there, and she can actually experience psychosis.
Like
Okay.
what?
A lot of times, yeah, so psychosis is going to be odd behavior, bizarre, not realistic, hallucinations, very impulsive. Depression is something that's diagnosed later on, down after 2 weeks. Okay. Blues is, a client that has postpartum blues can be suicidal. But they're not necessarily psychotic. So the difference between the two is psychosis is impulsive and bizarre hallucinations, delusional. Okay. They are hearing or thinking things that aren't true. Okay. That's the difference between the two. Okay. And sometimes if your client has a history of bipolar disease, and they haven't been compliant with their medications during the pregnancy because they were concerned that it would hurt the baby. So they stopped taking their medications. And there's a high risk for developing psychosis after delivery of the baby. Okay, because they've not been compliant, their chemistry is out of balance, and it's easy for them to actually hallucinate. Okay. What's your drug of choice for postpartum hemorrhage? If you go into the room, what is your first assessment for a postpartum client 30 minutes after delivery? What's the first thing you want to do when you go in the room?
For the baby or for both?
For the mother, postpartum assessment for the mother. You're going into her room.
We're talking about massaging, make sure it's not.
The first thing you want to do, think about it this way. You know that the number one cause of mortality postpartum period is what?
Hemorrhage.
Hemorrhage. Yeah, hemorrhaging. Okay. So what's the first thing you want to do when you go in the client's room? She's 30 minutes out from delivery. She had a normal delivery, but she was post-term.
Check the pad.
So she had a big baby, her uterus was stretched, so she's at risk for hemorrhaging. What would you do?
Check the pad.
You're going to check the pad first?
Assess the uterus.
Assess the fundus of the uterus first, right?
Check. Yeah, that's what.
Yeah, you want to assess the fundus first. So, remember Uber. U stands for uterine fundus. B is the bladder, and then the perineum or the episiotomy
Uber.
and the rectum. So Uber. So you want to always check the fundus first. Because even if her vital signs are low, which is a late sign of bleeding, and her peripad is saturated usually, most commonly, it's because the uterus is boggy. Okay, it's boggy, it's not contracting.
That's where
So
you have
make
to
sure-
massage it.
Yeah, so you need to assess if it's boggy, you better check that bladder. The bladder might be full. Okay, so Uber, or Uber,
Uber.
Okay.
uterine fundus and bladder. Okay, what would be your first drug of choice? Uterotonics, the drugs we use to cause uterine contractions. What would you want to use first? Have you had simulation on postpartum hemorrhage yet?
No, not me. It's
Okay.
coming Saturday.
Okay. What's your first drug you want to use? Seems like we've been talking about postpartum hemorrhage since week 4.
I'm not the
We can
drug,
use pitocin, huh?
but-
Yes, yeah,
Pitocin.
oxytocin.
Oxytocin and
Oxytocin is that
metillergonovine. Or metergia.
That's right.
Metergia.
That's perfect. Midel,
Pitocin,
that's perfect.
oxytocin is that pitocin?
It's the same thing.
Okay.
Yeah, oxytocin, remember, it's a natural hormone that the body produces. We give it also, and the brand name is Pitocin.
Okay.
Prostaglandin? Can we use prostaglandin too?
So we can use a prostaglandin, a high dose of a prostaglandin. How would you administer that, Maybell? How is it to be administered?
Prostaglandin is a. Do you put on the cervix?
Actually, no, you put it in the rectum.
On the
Yes,
rectum.
in
Okay.
the rectum. Yeah, because there's a lot of blood vessels in the rectum and it's absorbed very rapidly and it'll cause uterine contractions. So that would be your Cytotec. Okay, a
Rectum.
prostaglandin, yeah, or misoprostol, same thing. Misoprostol, depends who you talk to.
Misoprostol.
Misoprostol. So we can do that, yep. And there's the methylorgonavine or Methergin. Okay, so what are some contraindications to Methergin?
The Metorgen. Oh, the blood pressure. We have to take the blood pressure before give it to the patient. And
Yeah, we have to make sure
uh,
she doesn't have high blood pressure. Yeah,
Okay.
because it will increase the blood pressure.
Yeah, it's
So
not
you
gonna work for
You can't give it if she has high blood pressure. Okay,
no preeclampsia.
yeah,
No
that's
for
true.
patient with preeclampsia.
Yeah,
And the prostaglandin is the one we have to watch for asthma.
that's
Which one?
Hemabate. That's Hemabate.
Hemabate. Okay, Hemabate.
It works similarly, yeah, but we don't give Hemabate with asthma clients. Okay. All right. So we would use all the drugs we have available. We're going to put her on some oxygen. We're going to give her an IV fluid bolus of about 500 ml. We're going to weigh her pads to see what blood loss she's had. So if she lost, if it was a vaginal delivery, and she lost 400 mLs of blood, is that a hemorrhage?
No.
No. It needs to be at least 500, doesn't it? Yeah. Or 1,000 for a C-section.
That's one for C-section.
Okay. All right. Anything else? I'm running out of ideas.
So the math, 5 questions. One should be maybe to calculate the flow rate.
The what?
No, I'm saying between the 5 math is just like to check, like, you're not specific, like which one is which.
Okay, yeah.
Okay.
Yeah, just make sure you're reading the question. Take time to read it, okay? Make sure you're answering what it's asking you. And I know, is English your second language too, Jeffrey, or not?
Yeah, it's my second language.
Yeah, so it is more challenging for you, I know it is, so it does take a little more time. Mhm. Yeah, so, but make sure you're reading it, okay? You know, you have a minute and a half for every question, and that doesn't sound like much, but really it's a lot. And there will be questions that you're not going to use up that whole minute and a half. So you don't want to short yourself on the math because you think you're running out of time. Okay?
Yeah.
Okay. All right. The most important thing I can tell you, when do you take your exam? Friday, Jeffrey?
I have some time to read more. Yeah,
Huh?
Friday.
Friday.
Yes.
Yeah, so, and Mayville takes hers on Friday as well.
On Friday, yes.
Yeah. So I would tell you, you got a busy day all day. Now, Mayville says she does. Do you, Jeffrey? Are you busy all day?
Yeah, I'm busy the whole day up to
Yeah.
5
So what I would recommend is that you really get a good night's sleep before that day. Don't stay up late.
Okay.
Cramming, it doesn't really help. You think it does, but it doesn't.
It doesn't.
Get a really good night's sleep, eat a good breakfast, have some snacks in your bag.
The other test I did good because I didn't go to work. The other test I kind of messed up because I left work, ran home.
Oh,
I kind of realized I saw a big difference. So
yeah. All right. But that's what I would recommend.
yeah, so
And this next week, if you've already watched all the videos that are posted and you've watched the recordings from the instructors, I would recommend that you just work on some NCLEX questions. Okay, and do the newborn NCLEX questions.
newborn.
Okay. Mm-hmm. All right.
All right.
Mhm.
Thank you,
Thank you.
Dr. Sarah, for your time.
You are welcome. You are welcome. And I'm glad you were here. And I see Nicole has jumped on, and I will work with Nicole a little bit.
All right. Thank you so much.
You're welcome, Jeffrey. Thank you for coming.
No problem. Have a good night.
You too. Bye-bye. Hi, Nicole.
Hi, I'm sorry, I just got back home.
That's okay. We started an hour ago, a little over an hour ago, actually. But Nicole, you and I can work on, or Maybelle, you can stay on too. Nicole,
I want to listen. Yes. Thank you.
okay. Okay, Nicole, have you had a chance to look at the exam 3 PowerPoint?
Yeah, I've been looking over that last 3 days.
Oh, good. Oh, good. How do you feel about your math?
About my math?
Huh?
The only place I'm lacking on my math is the dimensional analysis, and I don't know why, because I'm usually really good on that, and for whatever reason, every time I keep practicing, I'm not doing well on it.
Okay. Would you be more comfortable doing it with proportional method instead?
Yeah, I'm good the other ways, but I don't know. There's been like some questions that I've done and it's saying like do it the dimensional analyst way, and I don't know. That's something I'll have to figure out.
Yeah, if you're not comfortable with dimensional analysis, this is probably not the time to learn it.
Mhm.
You need to use whatever works for you. Okay. You need to
Okay.
work. Yeah, you don't want to struggle with a method if you're not comfortable with that method. So if you
Okay.
don't want
I
to
wasn't
yeah.
I just wasn't sure if it was like something that I was missing that was different with that version than
What version?
the dimensional analyst version, because I
Oh.
usually use what's the name of it? It's probably the proportion method, like where you fill everything out and then you like cross out the.
Yeah. Oh, well, dimensional analysis you're crossing out, but you're always crossing out with no matter what method you
Yeah,
use.
I'm trying to think of, because it's like I'll have to figure out what that one's called, because that's the one I used in pharmacy. And that one I did
Okay.
awesome on.
Okay, well, that's
So-
what you need to use then,
Okay.
okay? So some kind of problems that you need to be familiar with are some of these that I posted, and I think I shared these during class. If you have an order to give a certain amount, and then you have a vial labeled, how much of that vial do you give? Okay, so
Okay.
there's some, this list, I did put this on in the announcements for you.
Mhm.
Do you remember seeing this?
Yeah. Yeah, this one
so-
this one I'm good on. I think I was just overthinking maybe.
Okay, so if you know how to do these kinds of problems, I think most of the nursing calculations that you need to know how to do are these kinds. 'Cause
Okay.
yeah, because if you're having to, yes, we need to do solutions, if you
Mhm.
have like this problem here, it says to infuse, we changed it up a little bit, didn't we? Infuse 100 ml IV solution, and it's labeled this, and this is how much they want you to run it at, then how much would you receive? So this is a several step problem. And so remember that when you're doing math problems that you're reading, you know what it's asking you for. Okay, you know what it's
Mhm.
asking for. So if you want to screenshot that so you can practice on that bottom one here,
Okay.
and maybe even both of these here, practice
Okay.
on that. Okay. So I'm glad have you watched any of the videos?
I watched some with my mom since she's in maternity right now as well.
Okay. Good. Yeah, all those short videos are really good to watch because they focus in on each concept.
Okay.
Okay. What else is there a particular area that you want help on, Nicole?
I think I feel pretty good on everything right now. Let me double check because I have
Okay.
like notes kind of random places.
Yeah, I gotcha. I've been embarrassed for any of my students to see my desk. Oh my goodness. So I want you to, for the exam, I want you to be really comfortable in
Okay. Rylan, if you're
priority.
gonna cry, you need to close the door. Okay, close the door if you're gonna cry. Close.
No.
Hey, I'm on the computer right now. Please, not in here, not in here. Please wash your hands if you're gonna touch that. Thank you. Sorry.
So be really comfortable in review assessment of a newborn. Okay.
Okay.
No
assessment of a
no
newborn?
APGAR. Yeah. Because
Okay.
this exam is about the newborn mainly. Okay. So those are some of the things that you really need to know how to do. Okay.
So